I now had to break the news to Bob and the kids.
This is the diary entry Deborah Douglas wrote on the day she was diagnosed with breast cancer.
We all hugged and stayed strong for each other. That was the biggest shock. He told me that the lump would have to come out.
She had chemotherapy and a mastectomy, but years later was recalled and told neither had been necessary. And the full mastectomy she thought her surgeon Ian Paterson had carried out was only partial.
Now down the line I realised that none of this was necessary. I should have had a lumpectomy. Not only did he leave me scarred physically and mentally, but he's left me at risk of a reoccurrence of breast cancer. If I needed a mastectomy, he should have removed all the breast tissue.
Ian Paterson was jailed for 20 years in 2017 for carrying out unnecessary and unsafe operations. His unregulated partial mastectomies meant cancer returned in many patients. Some have since died. An independent report has found hundreds of his patients were not only harmed by him, but failed by a culture within hospitals of avoidance and denial.
It's the story of a healthcare system which proved itself dysfunctional at almost every level when it came to keeping patients safe.
The report found evidence that complaints were ignored. The behaviour of some of those who worked closely with Paterson was found to be so bad, 5 have now been referred to the General Medical Council or Nursing and Midwifery Council, and 1 matter sent to the police.
My report sets out what can only be described as willful blindness in relation to Paterson's behaviour and aberrant clinical practice. Colleagues avoided or worked around him. Some could have known, others should have known, and a few must have known.
Concerns were raised by Ian Paterson's colleagues as early as 2003. Had they been acted on by the private and NHS hospitals where he worked here in the West Midlands, he could have been suspended then. Instead, he was allowed to continue working for a further 8 years, with devastating consequences. Leslie Cuthbert had major surgery after she was told by Ian Paterson that she had breast cancer. In fact, she didn't have cancer at all.
I feel really angry about that, because if people had been listened to, he would have been suspended in 2003, and my operation being in 2006 means that I wouldn't have had to have gone through any of this at all.
The report makes 15 recommendations to improve safety, including more information about consultants being made public, better communication between consultants, GPs and patients, and more effective complaints procedures in NHS and private hospitals.
We can't guarantee that this will never happen again. What we can say, and what I can say today, is that the department, we will do our very best to make sure it never happens again.
Spire Healthcare has apologised and accepted opportunities to challenge Ian Paterson's behaviour were missed. Paterson's patients fear unless improvements are made, there's a risk more people could suffer like they have.